This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Friday, March 27th. This is Africa 54. Now, due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at our VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. Mounting anguish, anxiety, fear, and sorrow continues to grip the world as first responders, medical professionals, and patients, and even family members cope with the sobering reality of the deadly coronavirus cases reported across 202 countries and territories around the world. And the United States has overtaken China as the country with the most confirmed infections, with more than 85,000 cases, according to Johns Hopkins Medical Center. Over 60,000 were added in the past 24 hours. The global death toll from COVID-19 is over 24,000, according to an early Friday Reuters count. The U.S. contributed roughly 1/3 of newly reported cases as testing in the country expanded, with over 17,000 cases in the past 24 hours and 281 deaths, the highest single-day case count in the country since the outbreak began. New York City is the epicenter of the U.S. outbreak, with more than 21,000 cases in the country's largest city, with officials saying that number is growing by at least 3,000 a day. Cases of coronavirus in South Africa climbed to more than 1,000 on Friday, according to the nation's health ministry. Fraught with fear of COVID-19, some of the city residents are returning to the countryside to escape the spreading virus. James Ayodele of the Africa Centers for Disease Control and Prevention says traveling is making it harder to trace the contacts of sick people. It also risks increasing transmission through overcrowded conditions. Ethiopia began releasing more than 4,000 prisoners Thursday in an effort to slow the spread of coronavirus. Attorney General Adanech Abebe says inmates convicted of minor crimes with less than 1 year left on their sentences and women with babies qualify for the release. The country is also deporting foreign inmates being held on drug trafficking charges to their native countries. Ethiopia has at least 12 confirmed cases of COVID-19. Prime Minister Abiy Ahmed is urging Ethiopians to practice social distancing even as large crowds ignore warnings and gather for events in the capital, Addis Ababa. Now, the World Health Organization warns COVID-19 could spread more in Somalia if the country does not scale up its preparedness measures. The country has neither testing kits nor strong health facilities. WHO says it plans to set up a center in the country within a short period of time. VOA's Abdulaziz Osman and Mohammed Olad have our report narrated here by Paul Ndiho.
There is concern and a sense of helplessness in Somalia after a student who returned from China tested positive with the coronavirus. The World Health Organization warns there could be more cases in the coming days if preventative measures are not put in place.
Knowing how the disease spreads to the close communities and the close contacts, there are all possibilities that we might end up with more cases in the coming days. As of now, there is one laboratory confirmed case and some other samples are being tested. So it could be the case that in the coming days we might find additional cases. We need to be prepared for that.
Somalia does not have testing kits. The country's healthcare centers are weak following years of instability. WHO says at the moment all the COVID-19 samples are shipped to a medical research unit in neighboring Kenya. WHO fears that if the virus spreads, it could overwhelm the already weak health system in Somalia.
I think this is very difficult to say what will be the death toll ultimately in this country. We all know the country is going through a severe protracted level of crisis, and we also know the health system is quite weak and fragmented. However, there will be a huge burden on the health system if we don't prepare ourselves and if we don't scale up our preparedness measures. Knowing that particular challenge and risk, it's everyone's responsibility to help the government to scale up those facilities for early testing, early treatment, and early patient care.
Somali medical experts are concerned after seeing the devastation of coronavirus in the developed countries.
Our main concern is that the disease is already hugely harming developing countries with all the facilities, mechanism, wealth, and resources. Imagine if it spreads into Somalia. You can imagine what the death toll will be in Somalia if nothing is done. If we are Somalis, having faith in Allah, we need to pull out all stops to prevent this disease from spreading into our country.
Somalia's militant group Al-Shabaab controls a large part of the country, and aid agencies that usually struggle to get access into these areas. Dr. Malik of the World Health Organization hopes that they will find a way of reaching those populations in case COVID-19 reaches to those areas.
Unfortunately, some of these areas in this country are controlled by this militants group. And also during our mass campaign for measles and polio, we struggle to get our vaccinators inside those areas. And I'm sure we'll face the same challenges. But if it's a situation, it's a time where solidarity will speak for itself. If we all understand that we all have a responsibility to manage this crisis, making sure that the lives are saved, making sure that the deaths are averted, I'm sure we'll find a way to put our officers, to put our surveillance officer, to put our medical officers inside those areas and to check whether the virus is spreading.
Residents in the major cities are already feeling the impact of coronavirus after the government closed schools, universities, and banned large gatherings. Somalia also suspended all international flights for 15 days as part of measures to prevent the spread of the virus. Paul Ndiho, VOA News.
The leaders of the world's foremost industrialized nations convened via teleconference Thursday to discuss the global coronavirus outbreak as data emerged that the largest of those economies is on track to record the most known cases of COVID-19. VOA White House correspondent Patsy Widakuswara explains.
In New York City, National Guard soldiers begin converting a convention center into a temporary medical facility to ease a hospital bed shortage as part of the state's response to the COVID-19 outbreak. The U.S. is on track to become the next epicenter of the pandemic, with the most known cases of COVID-19 exceeding China. President Donald Trump downplayed the statistics.
I think it's a tribute to testing. Number one, you don't know what the numbers are in China. China tells you numbers.
Trump and leaders of the G20, the world's foremost industrialized nations, teleconferenced Thursday morning to discuss the global response.
We have a lot of different ideas, a lot of good ideas. We're working together. The leaders gathered virtually around the world to discuss the whole subject of the problem that right now 151 nations have got.
Trump again called for opening parts of the country soon to salvage the economy, but public health experts warn against relaxing social distancing guidelines too soon.
We want to see some evidence that infections are slowing to the point where we may feel comfortable releasing some of the restrictions slowly, while also having a plan in place to rapidly identify additional cases and to isolate them critically.
With more than 81,000 cases in the U.S. and deaths surpassing 1,000, criticism has been mounting overseas about the Trump administration's approach.
My expectations are that things are going to get far worse before they get better. We, in the past, have been a leader for the world. I think very few people in the world now are looking toward the United States for leadership.
The virtual summit was called by the current G20 chairman, Saudi King Salman. In a statement after the meeting, the G20 announced they will inject more than $5 trillion into the global economy, share more health data, and address potential trade disruptions. Patsy Widakuswara, VOA News.
The U.S. military is manning the front lines in the coronavirus outbreak, from building hospitals to delivering test kits, and defense officials are advising the pandemic could be a 90-day problem, possibly continuing as late as July, a sharp contrast to remarks made by U.S. President Donald Trump this week. VOA Pentagon correspondent Carla Bob has more.
From packing non-perishables at food banks to testing and screening patients at drive-through sites, thousands of National Guardsmen are doing whatever they can to help a nation in crisis, with more help on the way.
Governors and adjutants generals are telling me that they're planning on bringing more in the near term, in the hundreds and thousands.
The Navy hospital ship Mercy is on its way to Los Angeles, with medical crews on board readying for patients. The ship will take in up to 1,000 non-coronavirus patients from LA hospitals, freeing up local beds and personnel as the number of coronavirus cases continues to rise. The military will soon send the Mercy's sister ship, the Comfort, and 2 Army hospital units to New York, one of the worst hit areas in the nation.
Right now, what we're looking at is about 140,000 cases coming into the hospitals. The hospital capacity is 53,000 beds. That's a problem.
The Army is putting hotel rooms in empty New York hotspots to good use, converting some into makeshift hospital beds. The Army will also send a hospital unit to hard-hit Seattle in Washington state. As the World Health Organization warns the U.S. is shaping up to be the next epicenter for COVID-19, Defense Secretary Mark Esper is preparing for a long fight.
I think we need a plan for this to be a few months long at least, and we're taking all precautionary measures to do that, to be in it for the long haul.
But as the military prepares to potentially combat the coronavirus into July, its commander-in-chief, U.S. President Donald Trump, has said this week he would like to have the country opened up by Easter, less than 3 weeks away. Carla Babb, VOA News, Washington.
More than 500,000 people in Britain are volunteering to help the National Health Service cope with the coronavirus epidemic. Henry Ridgewell reports from London.
A vast exhibition hall in London, the site of a new emergency coronavirus hospital due to open next week, has been built with the help of the British Army. As Britain braces for the peak of the coronavirus epidemic, more than 500,000 Britons have signed up to help the National Health Service in just 24 hours. Among them is Amira Gajia, who has closed her London cafe and is getting ready to help those on the front line.
I think I've seen the best in humanity at the moment in such a horrible time. Everyone is really trying to support each other and help each other.
Britain's Prime Minister praised the volunteers.
They will be driving medicines from pharmacies to patients. They'll be bringing patients home from hospital. Very importantly, they'll be making regular phone calls to check on and support people who are staying on their own at home.
The British government has been criticised for holding off implementing a nationwide lockdown until this week.
It's about doing the right thing at the right time. It's about trying to understand also how the different technologies are coming down the pipeline are being developed, the timing of those, antivirals, vaccines, etc., and how this can be deployed most effectively when they're ready. So I don't think anybody knows the right answer.
Until that answer is forthcoming, volunteers across the world are stepping forward. In Georgia's capital, Tbilisi, charities have switched from operating soup kitchens to delivering hot meals to vulnerable people stuck at home. In Nairobi, volunteers are checking in on elderly residents and spreading information on preventing transmission. In Poland, huge numbers of people have signed up on social media to help with anything from grocery shopping to dog walking. In many countries, people have taken to their porches and balconies each night to applaud the health workers on the front line of the crisis. And hundreds of thousands are offering their help, a demonstration of strength in adversity. Henry Ridgewell for VOA News, London.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, politics aside, a popular Ugandan musician and politician releases a song to help fight COVID-19. We'll be back. Welcome back to Africa 54. The coronavirus pandemic has shut down movie theaters and caused movie releases to be postponed in the US and China, the two largest film markets in the world. VOA's Elizabeth Lee has details on how the pandemic is affecting moviegoers and movie producers in both countries.
The movie audience in China is the fastest growing in the world, and Hollywood wants a piece of it.
Hollywood studios are increasingly making their films for the consideration of the Chinese market.
One such film, Mulan, with Chinese actors, was a movie Disney had hoped would make a big splash in China. But the coronavirus outbreak put the movie's premiere in China and the US on hold. The shutting down of theaters and productions in both countries will have far-reaching economic implications, say experts.
China's and the US film industries are very closely entwined. What we're seeing is an increase in Chinese investment in Hollywood studio films. So companies you may have heard of, like Alibaba or Tencent, are actually investing in films.
Such as Top Gun Maverick with Tom Cruise. But film experts expect things to change.
Following the economic numbers in China, I think we'll definitely see a pullback of outbound capital investment from the Chinese government. So on one hand, that will likely limit Chinese investment in Hollywood.
Some studios in both countries are looking to streaming as an alternative to the big screen during the pandemic. China's Wanxi Media is making this tentpole movie, Lost in Russia, online for free. Universal will release Trolls World Tour to video on demand. Universal is also making movies that were in theaters, such as Invisible Man, available for rent on streaming services. But there are pitfalls.
It's not sustainable over the long term to do that. It's not good for the theaters, and it's not good for the studios either, because theatrical is really where the money has been.
Yet, if theaters are closed for a long time because of coronavirus fears, consumer behavior may change.
Will people actually go back to movie theaters? We've already seen an overall softening of movie theater attendance because there are so many in-home entertainment options. My sense is that we may be seeing an overarching shift in certain consumer behaviors.
I've looked at surveys posted on the Chinese internet, some large-scale surveys of thousands of people in 70 different cities, and over 50% say they're reluctant to go back to the theaters. It's a wake-up call, and I think it will accelerate the importance of streaming.
What this means to the bottom line of film industries in China and the U.S. will depend on how long life is put to a screeching halt and what the new normal will look like after the pandemic. Elizabeth Lee, VOA News, Los Angeles.
Democrats and Republicans in the U.S. House of Representatives are preparing to pass a $2 trillion relief bill aimed at softening the blow of the coronavirus pandemic to the U.S. economy. The bill was unanimously approved in the U.S. Senate late Wednesday. If signed into law, the economic rescue package will be the largest of its kind in U.S. history. Haiti Adams Fitzpatrick spoke to VOA's national correspondent Jim Malone about the stimulus bill. She began by asking him what's included in it.
Well, first and foremost, it's to help average Americans with a check that will help them get through some of the early stages of this pandemic. The bill also includes money for corporations and small businesses, and also for hospitals and medical workers to help them, though we're already hearing a lot of medical professionals questioning whether there's enough of that aid in there for them, given where this pandemic may be going.
What were the major sticking points that made all of this take a few days?
There was an issue of balance. Democrats did not like the initial version that Republicans preferred, that seemed to emphasize helping businesses over average Americans. Democrats wanted more help for people who were going on unemployment. So I think there was a basic coming to minds on that. And as we saw in the Senate, the vote was unanimous, which is very rare. It was somewhat a departure from our recent politics in that Republicans and Democrats were able to find bipartisanship on the issue of what kind of balance to offer not only the average American worker, but also helping out the companies that need a real boost, because we are facing what most people now see as an economic recession. And that, of course, has political implications for President Trump and the U.S. presidential election campaign moving forward.
Do you see any signs that there might be tension over who exactly gets credit for the stimulus package? Congress, the president, Democrats, Republicans?
A lot of people will get to claim credit, I think, for trying to help out the country in a time of crisis. And certainly, we know President Trump is not shy about trying to grab his share of the spotlight and credit. He has a daily White House briefing, which is now substituting for his campaign rallies to some extent. The president wants to be seen at the center of this. The opinion polls show he's getting a slight boost in his approval ratings as long as he's at the center of it, and as long as the administration is seen to be doing things that help ease the crisis. But it's too early to know what the political fallout will be for the president and even for Democrats and members of Congress, because we're just so far away from knowing how this crisis will play out and what will be seen as the efforts to help it by the administration and by Congress. And that will have an enormous impact on the election in November. We won't know how they'll weigh in for some time yet.
So, Jim, this interview is moving to a little bit of a bittersweet note, because you are going into retirement. Of your decades of experience as a correspondent, not just here in the United States, but abroad, you were also a correspondent in East Africa. Can you share with us one of your most memorable reporting experiences on the continent?
I think the thing I remember most is no matter where I went, whether it was the nations of East Africa, Southern Africa, whether I was a volunteer in the Peace Corps in what was then Swaziland in the late 70s and early 80s, no matter how troubling the situation was, whether it was political unrest or visiting famine camps in Ethiopia and UN relief camps in Somalia or Uganda, the stoic nature of Africans and the way they persevered through very difficult times, kept their humanity about them, and were always very generous toward people like myself, outsiders and reporters trying to find out what was going on. I think overall, I have wonderful memories of being on a continent where, the governments didn't always measure up to the humanity of the people. And that was always sort of a sub-theme in the reporting, I think, for many of us who were chronicling what was going on the continent at that time.
Jim Malone, thank you so much for your time. Thank you for your excellent independent reporting. Thank you for blazing a trail. We wish you all the best in your retirement years.
Haiti, thank you so much, and I appreciate doing the interview. Thank you.
Popular Ugandan musician and politician Bobi Wine, also known as Robert Kyagulanyi, is pitching in to help fight COVID-19 in his homeland. He released a song Wednesday along with fellow artist Nubian Lee about the importance of personal hygiene. The rumba melodied song implores people to regularly wash their hands, keep a safe distance, and look out for symptoms like fever and cough. On Wednesday, Uganda confirmed 5 more cases of COVID-19, bringing its total to 14, 4 days after it recorded its first patient. President Yoweri Museveni's government has sealed the nation's borders, closed bars, and banned public gatherings to contain the. Sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, have a great weekend.